Chairman, Organizing Committee. Dr. Syed Shahid Noor, Chairman, Scientific Committee. And Dr. Muhammad Saber Maiman, Executive Director, Shaheed Mohtarma Benazir Bhutto Trauma Center, and Secretary, Organizing Committee, Pak Traumacon. Ladies and gentlemen, distinguished guests, and esteemed participants, a very warm welcome to the grand inauguration ceremony of the Pak Traumacon 2023, the first traumatology conference in Pakistan organized by the Shaheed Mohtarma Benazir Bhutto Institute of Trauma. It is with great pleasure that I stand before you as your master of ceremonies for this momentous occasion. My name is Zara Naqvi, and I will be your guide through this extraordinary event. Today, we gather here to celebrate the launch of a conference that brings together brilliant minds, innovative ideas, and groundbreaking multidisciplinary research on the field of traumatology. This conference serves as a platform for collaboration, knowledge exchange, and the exploration of new frontiers in the realm of accidental trauma surgery, medicine, and rehabilitation. We begin with the glorious name of Allah Almighty, and then we will proceed with the national anthem.
Bismillahir Rahmanir Rahim. Wat-tini waz-zaytun wa turi sinin wa hadha al-baladi al-amin. لقد خلقنا الإنسان في أحسن تقويم ثم رددناه أسفل سافلين إلا الذين آمنوا وعملوا الصالحات فلهم أجر غير ممنون فما يكذبك بعد بالدين أليس الله بأحكم الحاكمين.
Can we please all rise for the national anthem? Now to commence this auspicious ceremony, I invite Professor Dr. Syed Shahid Noor, Chairman of the Pak Traumacon Scientific Committee, to deliver the opening address. Dr. Shahid Noor will set the tone for this conference, highlighting the importance of medical advancement, fostering interdisciplinary collaboration, and acknowledging the remarkable achievements of the Pakistani medical community in trauma care. Dr. Shahid Noor.
Ladies and gentlemen, honorable dignitaries, the organizing committee of Shaheed Mohtarma Benazir Bhutto Institute of Traumatology, international faculty and national faculty, and respected guests, Assalamu alaikum. It's a great moment to inaugurate the first international trauma symposium organized by Shaheed Mohtarma Benazir Bhutto Institute of Traumatology at PC Hotel, Karachi. Trauma is an accident are a great cause of death and disability. And preventing trauma is an objective and aim to reduce the suffering of humanity. One of the aim of this arranging conference is to learn from international faculty and national faculty and make this trauma center a state-of-art tertiary referral center of excellence, and then have satellite centers around different corners of the city and all major cities of Sindh. And make this a fellowship center where doctors from all across Pakistan would come and have training, and we would elevate the structure of this trauma center to the level that doctors from across different countries would come here. This conference started with multiple workshops. 15 workshops have been organized and successfully completed and conducted by national and international faculty. We have different sessions of this conference, including trauma prevention and pre-hospital care. And this is an extremely important area where you can save life and you can improve disability of the patient. We have sessions on disaster management and mass casualty. We have sessions on acute trauma and emergency medicine. We have sessions on anesthesia and infectious disease in management of critically injured patients. And also during this conference, we are going to launch Pakistan Trauma Registry. After that, we are going to have sessions on definitive treatment, a regional approach. So the first approach is saving the life of the patient. And then once the patient is stabilized, then we concentrate on different areas, including neurospinal trauma, facial and neck trauma, chest trauma, abdomen and pelvis trauma, upper limb and lower limb trauma and vascular injury, and then rehabilitation and emotional wellness of these patients. We have poster competitions with 26 posters. We have panel discussions on different aspects. 2 panel discussions are on perioperative management of gunshot and polytraumatized patient, and multidisciplinary approach to facial and neck trauma. So in conclusion, this is going to be a wonderful experience. I would request all participants to make best use of national and international faculty who have vast experience from managing trauma and polytraumatized patients. And I wish my best of luck to the Trauma Center in Karachi. Thank you very much.
Thank you, Dr. Shahid Noor. Ladies and gentlemen, again, I request you for a round of applause for our Chairman Scientific Committee, whose valuable contribution to this conference cannot be forgotten. To mark the formal inauguration of this conference, I kindly request Secretary of the Conference Organizing Committee and Executive Director of the Shaheed Mohtarma Benazir Bhutto Institute of Trauma, Dr. Muhammad Saber Maimin, to come forward and share his thoughts on the establishment and journey of the Shaheed Mohtarma Benazir Bhutto Institute of Trauma. Thank you, Doctor.
Bismillahirrahmanirrahim. Ladies and gentlemen, distinguished guests, and dedicated health professionals, Assalamu alaikum. It is the great honor and privilege that I stand before you as the Executive Director of SMBBIT and Secretary Organizing Committee of Pak Traumacon 23, the first traumatology conference in Pakistan. Let me start with the brief introduction of SMBB Institute of Trauma, Karachi. It is the state-of-art Level 1 trauma center of Southeast Asia. Since its functionalization in 2016, it caters the need of patients from Sindh, Balochistan, and other provinces as well. It is privileged to provide free of cost treatment and management to injured traumatic patient, which is patronized by Sindh government. This institute is one of physical example of vision of Mohtarma Benazir Bhutto Shahid. The government of Sindh and the health department under the leadership of Minister Dr. Azra Fazal Pechua Sahiba, inspired by the vision of Shahid Mohtarma Benazir Bhutto, attaches the special attention to the promotion and provision of healthcare facility to all segments of the society. I would like to highlight how government has taken initiative to improve the health sector in the province of Sindh. Another outstanding example is Trauma and Emergency Response Center, Ladkana, under SMBBIT Trauma, which will be functional in coming days, inshallah. Sindh government has planned to establish a complete network of healthcare facilities for our people throughout the Sindh province. We are carrying same mission forward, that's to establish a comprehensive integrated trauma care system for the province of Sindh. Thus, it will provide high quality treatment and complete care to patients from prevention to rehabilitation. Today we gather as collective force of surgical expertise united by our continued commitment to saving lives and restoring hope in the face of traumatic injuries. Trauma in all its form has the power to disrupt lives and shatter dreams of individuals and communities. As healthcare professionals in Pakistan, we bear witness to physical and emotional toll that trauma inflicts upon our patients and their loved ones, and the lack of adequate resources for its treatment. It is in operating room amidst the chaos of trauma that we witness the transformative power of surgery. Each incision holds the potential to alleviate pain, repair unforeseen damage, and grant a second chance at life to those who have suffered. Yet, these are still thousands of people who cannot access the life-changing work necessary in those crucial moments of injury to save them from debilitating ends. As the Executive Director of Shahid Mohtarma Benazir Bhutto Institute of Trauma, I am immensely proud of extraordinary healthcare team of Trauma Center that tirelessly works day and night, saving lives and mending broken bodies. What started as a Government of Sindh pilot project to offer exclusive surgical trauma management has now taken a life of its own as this extensive SMBBIT Trauma Institute. When I joined this hospital in 2020, it became my mission to take the right steps toward the Institute's expansion, functionalization, and improvement in overall services. Not surprisingly, as with all mission that one undertakes, this was not an easy task, as almost immediately the COVID-19 pandemic was upon us. In times of crisis, our healthcare system, genuine strength, and the passion of our healthcare workers come through with the help of the hospital staff we were able to arrange and expand the beds capacity of our dedicated COVID unit from 26 to 90 beds, and we successfully tested hundreds of people during that demanding time. In these past 2 years, we have introduced new surgical specializations of thoracic and plastic surgery within the hospital, opened the first public sector cath lab for minimally invasive surgeries with our interventional radiology and vascular surgery departments, which offer completely free treatment that are covered in lakhs of rupees in the private sector hospitals. We also established ancillary health services of clinical nutrition and mental health and rehabilitation to improve patient care, and also inaugurated a blood bank for our patients. Not only this, but we have managed to get all our department accredited for training of FCPS Part 2 by the College of Physician and Surgeon, Pakistan. It is an immense achievement for us, and Alhamdulillah, we also have the Sindh Healthcare Commission provisional license. Today, it has been more than 5 years to the commencement of this hospital, and since my time here, we have accomplished every goal that we set our eyes on. Yet, there is so much more that remains to be done with establishment of our Ladkana Trauma and Emergency Response Center and the functionalization of BUNS unit on our 8th floor. I cannot stress enough the pride I take in our multi-modality approach to trauma care. We offer free of cost surgical treatment to patients in areas of trauma, orthopedics, neurosurgery, oral maxillofacial surgery, cardiac surgery, thoracic surgery, vascular surgery, plastic surgery, and interventional radiology. This starts right from ER till the time they are discharged. We make sure they are taken complete care of. My team, your dedication, expertise, and compassion are driving force behind the success of our institute. I extend my deepest gratitude to each and every one of you for your tireless efforts and untiring commitment to the field. Pak Traumacon is a proof of our collective commitment to continuous learning and improvement. As we engage in meaningful discussion, listen to expert presentation, and participate in interactive workshop, let us seize this opportunity to broaden our horizon, deepen our understanding, and refine our surgical skills. The knowledge gained and connections forged during this conference will undoubtedly shape the future of traumatology. In closing, I want to express my deepest gratitude to the organizing committee for their tireless work, for their endless efforts in bringing this conference to fruition. Your dedication, meticulous planning, and attention to detail have created an environment that fosters collaboration, innovation, and sharing of best practices. I am also thankful our sponsors, partners, collaborative professional societies, and media partners. Without their cooperation, this event would not be possible. Together, let us welcome the challenges that lie ahead, armed with the knowledge, skills, and collective wisdom that we gather during this conference. May the lesson learned, the connection made, and the innovative ideas shared here today inspire us to continue pushing the boundaries of surgical traumatology as we work together to heal, to restore, and to save lives. Thank you, and I wish you all to productive time at the conference, and I hope to see you all next year at Pak Traumacon 24. Allah Hafiz.
Wonderful words, Dr. Saber. You've certainly done a lot for the Trauma Center. Since your time here, the Trauma Center has expanded in leaps and bounds. Now, on that note, talking about support, so support comes in many different ways, financial and emotional and legislative. So over here, I'm going to invite someone who's always been very supportive of expanding healthcare education and making sure that healthcare education is provided in a quality format in Sindh and in Pakistan. I would like to invite Professor Dr. Amjad Siraj Meeman, Vice Chancellor, JSMU, to come on stage and kindly say a few words.
Bismillahirrahmanirrahim. Distinguished guests sitting on the stage and in the audience, ladies and gentlemen, Assalamu alaikum. I am really thrilled. I'm very grateful to the organizing committee, especially Dr. Sabir Memon, who came this morning to my office to invite me to attend this event, which is so close to my heart. As an 18-year-old in 1981, I joined this medical college, and on paper, I retired 3 months back. So it's 42, 43 years that I spent in Dow Medical College and Civil Hospital. It was, a row was created once. अगर आपको पुरानी तारीख का पता हो सिविल अस्पताल का, तो पीछे एक न्यूरो सर्जरी वार्ड और एक आई वार्ड हुआ करता था. It was such a dingy place जिसमें घुसते हुए लोगों को डर लगता था. सर्विसेज वहाँ पे भी प्रोवाइड की जाती थी, माइंड यू, बट हालात वहाँ के बहुत पतले थे. वहाँ पर जब ये ट्रॉमा सेंटर की बुनियाद रखने की बात हुई तो देयर वाज अ लॉट ऑफ रेजिस्टेंस कि आप अपनी कंफर्ट जोन से निकलना नहीं चाहते हैं. आप अगर एक यूनिट में बैठे हैं तो आप चाहते हैं मैं इसी को चलाता रहूं. लेकिन जो विजनरीज थे उस वक्त के हेल्थ डिपार्टमेंट गवर्नमेंट ऑफ सिंध ने हमेशा it went leaps ahead of all other provinces. And only today, just before coming to this event, I was watching our Foreign Minister Bilawal Bhutto Zardari Sahab deliver a speech at Fazaiya Medical College Convocation at Islamabad. And he was very careful not to forget the efforts of the Sindh health department, and the services like NICVD, like trauma centers, all across the province with satellite centers and this, that and the other. You have such a long list of achievements of special interest taken by Dr. Azra Pechuo and Siraj Sumro Sahab. And of course the dynamic leadership requires all the bureaucratic and secretarial services, and Zulfikar Ali Shah Sahab has always been on the forefront. I am part of Jinnah Sindh Medical University as a Vice Chancellor now, but I have spent, as I said, so many years in Dow. There used to be an emergency operating theatre without any air conditioning, without proper instruments, and उस ज़माने में bomb blasts होते थे, gang war होती थी. I remember most are healthcare professionals, so you know what a laparotomy means and a thoracotomy means. We used to have something like 17 to 18 cases during the night. And as a 25-year-old, जब मैं जिस वक्त थिएटर से निकलता था तो मेरे पाँव में जूता नहीं घुसता था. उस वक्त जो हालात थे और आज जो हालात हैं, मैं अकील साहब को अभी बता रहा था साथ बैठे हुए कि if you have not visited that place, you must. उसके बाद मैं जिन्ना जब पहुँचा हूँ तो I have seen the beautiful work done by Chapra Sahab and Tariq Mahmood and his team. And it must be appreciated because हम इस शहर के बासी हैं, इस प्रोविंस के बासी हैं, इस मुल्क के बासी हैं, और हमें इसको एक कलेक्टिव तरीके से चलाना है. कराची शहर को अकेला ट्रॉमा सेंटर कुछ भी नहीं कर सकता. द न्यूरो सर्जिकल डिपार्टमेंट ऑफ ट्रॉमा सेंटर इज़ सो गुड दैट अब कोई एम्बुलेंस ड्राइवर और किसी जगह लेके ही नहीं जाता. हम लोग जिस वक्त मैं वहाँ था एज अ प्रिंसिपल डाउ मेडिकल कॉलेज, हमने एक मरतबा सर्कुलर निकाला था कि भाई न्यूरो सर्जरी के और भी डिपार्टमेंट्स हैं, खुदा के लिए थोड़ा उधर उधर ले जाओ, क्योंकि वी वर ऑलवेज चॉक अ ब्लॉक. वी हैड हार्डली एनी स्पेस लेफ्ट. हर जगह न्यूरो सर्जिकल पेशेंट आता था. आई एम सो हैप्पी टू सी माई ओल्ड फ्रेंड्स सिटिंग हेयर. जिन्होंने उस बिल्डिंग ब्लॉक्स हैं वो लोग, जब हमने इसकी बुनियादें रखी थी. एंड आई मस्ट से कि एक आदमी का नाम इसमें अभी तक मैंने नहीं सुना जिसकी टायरलेस एफर्ट्स, उसका विजन, उसका मिशन कह लें, प्रोफेसर डॉक्टर सईद कुरैशी. I think it will be very, very bad if we forget him today. He's probably not in attendance due to some personal reason, but it was him who forced us to start operating in that theatre, theatre was ready, but the trauma center wasn't ready yet. उस वक्त कभी लिफ्ट चल रही होती थी, कभी उस पर फिर एक चिलर्स का प्रॉब्लम आया था कि हर जगह पानी भर जाता था. बहुत सारे टीदिंग प्रॉब्लम्स जो किसी भी बिल्डिंग में बनते हैं. But it's a lovely building, it's a wonderful experience to have operated there. हमने अल्लाह ताला को खुश करने के लिए किया, ये किसी और मकसद से नहीं किया. और आइंदा भी मैं साबिर मेरा बहुत बचपन का दोस्त है, इनको मेरी आई ऑलवेज टोल्ड हिम दैट माय सर्विसेज आर ऑलवेज अवेलेबल टू यू. एंड मैं एक ज़रूर ये बात कहूँगा कि क्योंकि जब थोड़ा सा इस पोजीशन में जब आदमी आता है तो बहुत मीटिंग्स का पार्ट होता है. तो ट्रॉमा सेंटर लेवल 1 ट्रॉमा सेंटर यहाँ पे बन गया है, लेकिन कराची के जो बाकी रूट्स हैं, स्पेशली जो रूट कम्स फ्रॉम बलूचिस्तान, वहाँ पे जब बस उलटती है हम पढ़ते हैं तो जब तक हम तो पहुँच जाते हैं, लेकिन वो उनको वहाँ से यहाँ पहुँचने में जितना टाइम लगता है और उस दौरान जो ब्लड लॉस और जो डिफॉर्मिटी और जो ये चीज़ें हो जाती हैं वो इर्रिपेरेबल होती हैं ज़्यादातर, और वो सल्वेजेबल इंजरीज अनसल्वेजेबल बन जाती हैं. इसलिए मैं ज़रूर ये बात कहूँगा कि आपको आइंदा के फ्यूचर के लिए अपने, जिस तरह आपने लाड़काना का जिक्र किया, तो जो हब रिवर रोड है, जो बलूचिस्तान का जो हमारे पास फीडिंग जो रोड है, उसके ऊपर एक ट्रॉमा सेंटर की शदीद ज़रूरत है. आई स्पोक टू वहाँ पे जो वहाँ से MNA हैं, शायद डॉक्टर कादर पटेल साहब हैं, उनसे मेरे डिस्कशन हुआ था. वो ही वॉज ऑल फॉर इट, ही वॉज रेडी टू प्रोवाइड स्पेस फॉर अस. एंड अकील साहब अभी बात कर रहे थे मुझसे कि यार हमें जगह बताओ. एंड इस तरह के जो काम जिस तरह पैफ ने किए हैं जिना में, या ट्रॉमा सेंटर ने जो करके दिखाया है, हम इससे ज़्यादा की हमारी डिमांड है, हमारी रिक्वायरमेंट है. एंड आई एम श्योर दैट पीपल लाइक दिस इज़ ऑलमोस्ट द एलीट ऑफ कराची सिटिंग हियर, not only from the academia and the healthcare professionals, but I see many people from various walks of life. And in the end, I will just wish you all the best. Any conference which is educational inspires you. It tells you what you can do. There are things that you can do, but आप डर रहे होते हैं कि यार ये पता नहीं मुझसे होगा या नहीं होगा. इस तरह की conferences में foreign experience आता है, वो आपको बताता है कि यार दिस इज़ अ डूएबल थिंग एंड वी कैन ऑल डू इट. एंड आई एम श्योर कि शाहिद नूर, माय क्लास फेलो, पता नहीं कहाँ गया, तो अच्छा यहीं बैठा है, तो ही हैज़ अ लॉट ऑफ सर्विसेज इन द एकेडमिया. लियाकत नेशनल का ये बैकबोन है आदमी. अब वो हमारे साथ, इनको हम कोशिश करके ले आएंगे फुल टाइम कोशिश करके, और ये इट विल बी अ गुड एडिशन. इवन अदरवाइज द एकेडमिक पार्ट जो है उसको ये स्पेयर हेड कर रहे हैं, और इसमें आई एम श्योर वी हैव अ लॉट टू लर्न. अ वर्ड ऑफ ग्रैटिट्यूड स्पेशली टू द हेल्थ डिपार्टमेंट, जिसका मेरे ख्याल में और कोई भी डिपार्टमेंट पैरेलल नहीं कर सकता गवर्नमेंट ऑफ सिंध में. थैंक यू वेरी मच.
Thank you so much, Dr. Amjad Siraj, for your profound experiences and your words of wisdom. And now, I would like to invite the AG Sindh, the Accountant General of Sindh, Mr. Mahmood Amir, on stage, please, because he's really played a big part in offering financial support to ensure accessible healthcare in the province of Sindh.
Honorable guests, doctors, civil servants, let me confess that I was not prepared for this speech, therefore I will take only a few minutes. I think culturally, whether we ignore listening to our parents or to our teachers, but we never ignore the advice of a doctor. That is the status of a doctor, that we have in this country or anywhere else, anywhere in the world. I think a traumatologist, if that is what it is called, has to be a heart specialist, a pulmonologist, I don't know what different terms you name them by. Before coming to this post, I was a DG Audit Defense Services South. South includes 5 corps in Sindh and 12 corps in Balochistan. And I found that it is the most organized service that we have in Pakistan. Next to it, I think I would call the medical services or doctors as the most organized service that is being provided to this country. I think a traumatologist has a few moments or very little time to save a life, to save his body parts, his limbs. And it needed to be a specialized discipline, I would call it. The civil service that I come from provides financial support to district governments, to provincial governments, to federal government, to different ministries. And we are the ones who bring your pay every month into your bank account without delay and without fail. And we are the ones who make you able to pay your bills before it gets too late. This is a very big step towards the health facilities in our country. I come from Balochistan. I did all my studies from Quetta, and Balochistan was just mentioned here. I hope that this facility is also extended to a poor province of like Balochistan. And whenever people are sick to a condition that they cannot find any remedy in Balochistan, most of us rush to Karachi and we are treated here, not because the doctors in Balochistan are not good enough, but because we do not have those facilities, that machinery and equipment that is necessary, because necessary for the use of a doctor to save a life, to rehabilitate a person, especially during an accident or trauma. I hope that this service is also extended to Balochistan. As far as our services are concerned, we make it a point to follow the priorities of the government, which a provincial or a federal government sets for its community, for its citizens. And education, and especially education in medical sciences, is the most important priority that the government sets. Our duty and our endeavor has always been to make it possible for the government, for the citizens of this country, that they get that financial support in time, like a medical aid in time. Because when it's late, for example, we are approaching the 30th of June, and we have to pass all the bills that are presented to the AG office, and we always make sure that all of those facilities, all of those bills, all of those financial assistance is being adequately given on time to the government to complete the jobs that they have to complete. I think that will be all that I need to say at this moment. Thank you all very much. and we love our doctors. Thank you.
Thank you, Dr. Mahmood Amir. Now, to provide a comprehensive overview of this conference, I invite Mr. Zulfikar Ali Shah, Health Secretary, to share insights about the overarching conference theme of trauma care in the digital era and the objectives of the Sindh government to the health sector. Mr. Zulfikar will also highlight the necessity of trauma-focused intervention in Pakistan and the expected outcomes of this esteemed gathering. Mr. Zulfikar Ali Shah.
Thank you very much, Honorable Mr. Qasim Siraj Sumro, the chair of this moment and event, distinguished guests, foreign delegates and local delegates, my fellow doctors, paramedics, nurses, members of the civil society, our partners, donors, and friends, Assalamu alaikum. It is indeed a true pleasure to be here and address this auspicious gathering and on this event of launching of this seminar and gathering, which is a source of interaction and learning from each other. Allow me to reiterate few basic facts. First of all, the commitment of Sindh government, starting right from our Foreign Minister Bilawal Bhutto Zardari Sahab's commitment to the cause of health in the province and in the country, but also Honorable Chief Minister Sahab, who has been very upfront and always available when it comes to any issue that is health related, any kind of assistance. Whenever we have asked as civil servants or the civil society has asked and requested him, he has always provided assistance and still willing to go out of the way to provide any facility that is needed. We are very lucky to have a doctor who happens to be our minister, so she understands the subject pretty well, she's passionate about it, and she has done a significant amount of contributions in the health sector in the province. And last but not the least, teamwork, of course. We cannot, this speech is not complete without mentioning the name of Dr. Sabir, because he and his team has made this trauma center possible as a living, breathing example of center of excellence for others to follow as well. Ladies and gentlemen, it's very important that we see this subject in a very holistic manner. This is not just a hospital which provides trauma services, but Sindh government is cognizant of the fact that we need to address the issue of accidents and traumas at a quality which is service that is provided at international level. For that purpose, for instance, we have started Sindh Integrated Health Services 1122. Most of you might have seen those ambulances. The concept behind it is very simple, that ambulances are not mere carriers of patients, but they also provide instant medical assistance to any event of accident. And taking this opportunity, I'll also invite our donors and partners and friends and NGOs, especially who are providing ambulance services, to please join hands with us and adopt the same concept so that our emergency services are effectively provided to the government, to the people, and in a timely way and a more effective way. As Dr. Siraj was mentioning and Dr. Sabir was also mentioning, again, in terms of holistic manner, we usually see this trauma in a very, in a manner that it's just corporal hurt or body hurt, but what we are lacking is several ways in which we have to build the capacity. For instance, hazardous material management. I think any trauma arising out of it, we don't have adequate capacity, so I invite all the trainers here and the doctors and the experts to please dilate upon and also teach and also try to build the capacity of all sorts of accidents, a diverse array of that we face at different times. We are also, Government of Sindh is also committed to expand this trauma centers in all parts of the province, as well as on highways and wherever they are needed. So inshallah, we are trying our best, but last but not the least, nothing is possible unless all the entire civil society joins hand. I'm extremely grateful to our civil society partners, our NGOs, our doctors, and especially those doctors who, irrespective of wherever they work, are passionate on this topic. We really look forward to their assistance, and we really look forward to expand these services. I wish a lot of good luck, and I'm anticipating that this event will provide good opportunity for the experts to interact with each other and learn from their experiences and enhance this experience as well. Thank you all. Thank you very much.
Thank you, sir, for your insight and presence. And now I would like to invite our guest of honor for the night, Mr. Qasim Sumru, Parliamentary Secretary Health. Please, sir, grace us with a few words on the momentous occasion of Pak Traumacon's inauguration.
Bismillah ar-Rahman ar-Rahim. Distinguished guests sitting here at the stage, and ladies and gentlemen, and I'm seeing so many faces that are known to me, and they are really, really inspiring to me. Just like Dr. Tariq is sitting here, Mushtaq Saab is sitting here, Akil Karim Dedi Saab, and so on. The number of people, galaxies sitting here. Assalamu alaikum, haq mawjood. It's really indeed a pleasure to come here and in fact talk about the traumatology, and then we are moving onwards with the subject that is very close to so many of us. I, on the behalf of Government of Sindh and of course Madam Minister, and we all are, we have so many people talk about the healthcare system, and of course we have so much we have achieved in terms of healthcare, particularly in tertiary care health in Karachi, or maybe in more of our urban clusters, and I am glad that we have something very advanced, but yes, we are still lacking on so many fronts, particularly in our rural sector. And in our previous event, in fact, I was requesting Chapra Sahab, now since Akil Karim Dedi Sahab is here, we are partnering in so many ways, Government of Sindh with the help of Patient Aid Foundation, then a number of other NGOs that we are in collaboration with. We need something of such nature, centers to be established somewhere in the rural areas. And we have, I mean, it's not like we have targeted now the different regions that how and where we can establish such centers, and particularly with this trauma facility. We recently have developed, or in fact, it will be started in, I think, in a week time in Larkana, and then in Hyderabad as well, and then all over, like 8 places we are starting on the highway, and then 2 in other cities as well, which, as Amjad Raj was saying, one in the hub. In the hub, we have a 400-bed facility, inshallah, we'll be establishing. And then one facility in Razakabad as well, which is again on the national superhighway, M9. So that was the facility is almost gray structure is complete, and we will hand over to Shahid Mohtarama Benazir Bhutto Trauma Institute. So these all are facilities that we are in a process of developing. Yes, we are doing so much in other fronts as well. Again, it's a very tricky and very as Secretary Sahab was saying, you know, I believe we all are agree. It needs a holistic approach, and there are a number of other issues that are related with. We need to have a very comprehensive strategy in terms to deal with such trauma. There are emotional traumas, and then we have so much psychological problems these days, post-inflation, post-flood as well. Then COVID has risen so many of our issues that to a next level. So all these things, we need a comprehensive approach. And yes, we are in a way, mental health is another area where we are closely working now. Madam Minister has put a focus on it. Our Chief Minister is, in fact, is so forthcoming that whenever any civil society organization came with any idea that to collaborate with the government of Sindh, he always been vocal about that if you are contributing this much amount, we'll contribute this much amount. In fact, in a matching way or sometime more than somebody generates. So it's like a leadership is very clear. Yes, we have issues in primary health care. And in fact, this is one of the area that a preventive side of our healthcare is again a big challenge, and we have not been able to so far live up to the standards. Yes, we have done so much on the curative side. Our most advanced equipment, surgeries, facilities are available in Pakistan, and in fact in Sindh, more in Sindh, not in if you compare with other provinces. We are, in fact, hosting many patients from neighboring countries, even from the other parts of the Pakistan as well. So it's like we need to, and I'm sure that from these sort of events, these sort of conferences, we will learn the number of preventive measures, the number of more scientific or sub-special areas whereby we are. And in fact, we may require more intervention in terms of from the government side, from the civil society organizations, and we are ready to partner with anyone. Health department is always focused on this, and I'm sure with the Dr. Saber is here, of course, we'll get all the information that whatever being discussed here, inshallah, with the government of Sindh, health department, our leadership, we all are there to support any cause that is essential for the people of Sindh. Really, thank you very much.
Thank you, Mr. Sumra, for your time. Before we move forward with the evening, let us take a moment to express our gratitude to all those who have worked tirelessly to make this conference a reality. I would like to invite Professor Anisuddin Bhatti, Chairman, Conference Organizing Committee, to please come on stage on behalf of the SMBB Institute of Trauma and extend our heartfelt gratitude to all those who contributed their time, expertise, and resources to make this event possible.
Bismillahirrahmanirrahim. Indeed, it is my great pleasure and honor to be here among this great gathering of academicians, health providers, administrators, over the above, our leaders from the politics, and Parliament Secretary, Mr. Qasim Siraj Sumro, Secretary Health, Dr. Zulfikar Ali Shah, Dr. Amjad Siraj Memon, Vice Chancellor, and some others as the Accountant General, Mr. Mahmood, and I may name some other people who are here, assembly members, and our philanthropist from the civil society, Professor Razak Sheikh, Registrar CPSP, and Mr. Chapra Saab, Mushtaq Chapra, Madam Nadra, and Akil Dedi, who has been always support to the Trauma Center. On behalf of this organizing committee, I extend my gratitude and thanks to you all for being here and for your kind support every time in the year. To organize such an international event, and first in Pakistan and first by the first Trauma Center of Pakistan, was a truly an uphill task. The contribution of every member of various committees and administrative staff and advisors is really laudable. We are thankful to each one of you. It will be injustice if I shall not mention and pay special strength to my friend Dr. Sabir Memon, ED, Chairman Scientific Committee Shahid Noor, Co-Chairman Professor Shahjahan Kadbar, and all others who has done a laborious and mental job to organize this wonderful international conference to gather all the information and skill transformation that were the place and transfer their skill to our members of the health community, from doctors to paramedics to nurses. Besides 2 days conference inaugurated today, where a significant number of international and local invited speakers and free paper present will share their experience, we held multiple hand-on training workshops since Monday. There were around 16 hand-on training workshops, which were mostly aimed at the field of trauma for prevention of disability and death occurring amongst the simple trauma from polytrauma just before of a late presentation and delayed presentation at the institute. That was a great job done by our native experts and organizers and support team. We are thankful to you, everyone, member of the team, for accomplishing this huge task to serve the humanity. We expect participation from great number of the delegates from all over the Pakistan, as has been enthusiastically participated in the workshop, which was very well attended, and a public awareness walk on Sunday morning at 8 a.m. at the seaside, just to create the prevention program of the trauma and disability and prevention of life. We will hold this walk at the seaside on 8 a.m. morning on the Sunday. Once again, I would like to express my heartfelt thanks to our chief guest, guest of honor, political leads, members of the organizing committee, and the support team for your presence here and helping in organizing these mega events. Thank you very much. Long live Sindh, Pakistan, Paindabad.
Thank you, Dr. Bhatti. This evening, we also take a moment to recognize and honor the exceptional contributions made by individuals in the field of medicine. I invite Mr. Qasim Sumro on stage again to present a series of prestigious awards highlighting the remarkable contribution of those who have given their life to this profession. First up, we have our Lifetime Achievement Awards. The Lifetime Achievement Award for their dedication to this field of anesthesiology and her efforts at the SMBBIT Institute of Trauma, Professor Dr. Sadka Aftab. Our next Lifetime Achievement Award for her dedication and devotion to the field of infectious disease and her efforts at the SMBBIT Institute of Trauma goes to Dr. Shaila Baki. Dr. Shaila Baki is not here with us at the moment, so I'd like to invite Dr. Sadia Amer, her colleague, to take the award on her behalf. And now we have a Memorial Recognition Award. We would like to present this award to Dr. Yunus Sumro, renowned orthopedic surgeon and Minister of Works at the Government of Sindh. Dr. Yunus Sumro's family could not be here with us today because he was Dr. Sabir's mentor. I would like to request Dr. Sabir to take the award on his behalf. And now, next series of awards. The first award that we'd like to present for their contribution to the Pak Trauma Conference and the SMBBIT at large, Dr. Professor Said Qureshi, and I would like to request Dr. Amjad Siraj Memon to take the award on his behalf. Our next award is for Professor Dr. Amjad Siraj Memon for his presence and his contribution to the Pak Trauma Conference and also to the field of education and medical sciences. Our next award, and I would also like to invite on stage Mr. Zulfikar Ali Shah to present our next series of awards, please. I would like to invite on stage Mr. Mahmood Amir Sahab, AG Sindh, to receive his award for his presence at our inauguration ceremony and for his contribution to healthcare services in Sindh. I would like to now invite on stage Professor Dr. Saeed Shahid Noor to receive the award for his contribution to the Pak Traumacon. And now I would request Mr. Qasim Somro and Mr. Zulfikar Ali Shah to present an award to the Chairman Organizing Committee, Mr. Professor Dr. Anisuddin Bhatti. Our final award for the night is, of course, it goes to Dr. Muhammad Saber Memon, Executive Director, Trauma Center, and Secretary, Organizing Committee, Pak Traumacon. I'd request Mr. Qasim Somro and Mr. Zulfikar Ali Shah to present him with his award. Thank you, sirs. As we conclude this inauguration ceremony, let us carry the spirit of curiosity, innovation, and collaboration throughout the course of this conference. May it serve as a catalyst for transformative discoveries, inspire new breakthroughs, and strengthen the bonds that unite the medical community. Now it's time to embrace the spirit of camaraderie and networking. We invite all attendees to gather in the designated area for refreshments, where you can engage in fruitful conversations and forge new connections that will shape the future of scientific research. Thank you, and let the Pak Traumacon 2023 begin.